Tim Bonack here from Manual Edge Physiotherapy. I'm a physical therapist and Canadian trained osteopath. And I have my assistant Bo here, who is a basketball player at UCCS. And Bo, why don't you tell us a little bit about your lower back?
So I've had issues with my lower back for a while. They're not like chronic, so I just don't get them treated. But I notice it the most when I'm lifting weights, whether that's like a front squat or back squat or trap bar deadlift. It kind of just feels like something like pinches. So.
Okay, pretty classic. So Bo, I'm gonna have you face that way and go ahead and bend backwards and see what it feels like. You can see she's pretty flexible, but she does experience what?
Yeah, there's some pain in the lower left back area.
So we're gonna evaluate that real quickly and then treat that. Bo, why don't you lay on your back here? So we're gonna look specifically at the pelvis. So this is the pelvis. Bo, if you can support here, okay? And so pelvis here, I'm putting my hands on either side of the bone here and I'm assessing how it gives, what the mobility's like. When I do that, this is loose on the left side, but it's more stuck on the right. It's stiffer, there's not as much movement. Bo, turn over on your tummy for me. With Bo on her tummy, we've got the pelvis like this. And I'm essentially looking at the sacrum, which is the large bone at the base of the spine. So the sacrum is here, on her it would be here. And all we're going to do is we're going to test mobility. So she has pain on the left side, but when I test it, it's really loose, okay? When I test the right side, it's really stiff. And when I look at the sacrum itself, the sacrum, where my hand would be, is twisted to that right side. So to treat it, we're gonna have Bo lay on her left side, slide toward me, a little bit more with the hips, that's good. I'm gonna put my finger on the joint, let everything relax. This is a very, very gentle technique. Good, right to there. We're gonna bring the top one forward. Bo, I'm gonna have you look at the camera. Let this roll back to there. We're gonna bring the leg forward, let it fall. Hold the leg in the air, hold it up. I'm just gonna give it a little pressure here. It's an isometric contraction. Relax, that's to release the left sacroiliac joint in the sacrum. And we're gonna do that a total of 3 times. We're gonna bring this forward, let it fall. Hold in the air, good, hold it up. I'm gonna give it a little pressure here. Relax. Let that relax again. Let me reposition. A little rotation here. So this is a very, let it drop, a very easy, gentle technique. Hold it in the air to mobilize the sacrum, and in her case, try to relax it. De-rotate the sacrum that was turned to the right. Bo, go ahead and stand up for me on the side of the table. And go ahead and do a backward bend and just see what that's like.
I don't feel any pressure on the left side.
Good. So that's just a way of mobilizing that sacrum. We use it a lot for lower back pain. In Bo's case, with as active as she is, that should really help to get things moving for her. Thank you.